Well, it's not often an entire continent eradicates a disease, but on August 25, 2020, that happened when Nigeria was declared polio-free, clearing the virus from its last redoubt in all of Africa. The person who did more than any other to drive polio to continent-wide extinction was Dr. Tunji Funsho, a former cardiologist and now the chair of Rotary International's polio eradication program in Nigeria. Dr. Funsho could have retired years ago, but in 2013, with polio still paralyzing children across Nigeria, he decided to step up to lead the Rotarians' effort. Together with the Bill and Melinda Gates Foundation, the WHO, the CDC, and UNICEF, Dr. Funsho and Rotary helped lead national immunization days, getting millions of doses of the polio vaccine to children in cities and villages around Nigeria. In recognition of this innovation and achievement, Tunji Funsho has been named one of the Time's 100 most influential people in the world. Time, which recently released its 2020 list, recognizes the activism of the world's most influential individuals. And Dr. Funsho is the first Rotary member to be honored by Time, and he joins us live now on Newsday. Good to have you, Dr. Funsho.
Thank you very much for having me.
Let me begin by congratulating you and ask you, how does it feel to be one of the most influential 100 people who tried to change the world in 2020? And does this come with any added pressure?
Well, I mean, it's a humbling experience, you know, to find oneself in this very, very unique position of all the people who have impacted the world, and I'm sure there are hundreds of thousands of them, you know, to be picked, you know, amongst 100. So it's quite humbling. I feel highly honored, and I feel honored for my organization, Rotary International, that has created the pedestal for me to find myself in this situation where the work I've done in assisting in polio eradication in Nigeria and Africa worth considering, you know, as one of the 100 influential people by Time.
All right. Congratulations once more, Dr. Funsho. Now, this is a quote, I guess, from you. Eradicating white poliovirus in Africa was a team effort that required the cooperation and dedication of governments, partners, Rotary members, hundreds of thousands of health workers who choose to have their children vaccinated against polio. Now, tell us about this team effort, the challenges, and how we, as Africans and governments, can adopt this standard for more exploits in not just your field, but in other fields.
Yeah, thank you very much. I think this is a very, very pertinent question at this time, because up till this time, we've had an uphill task, you know, for us to come together, the public, the private sector, the communities, to work assiduously and tenaciously towards one goal and stay with it no matter what the challenges are until we get the results, you know, that we envisioned at the beginning. It's been a long trip. And part of the reason why it's so long is because it was bedeviled with a lot of challenges. But we stuck together, government, partners, Rotarians, and the communities who are the beneficiaries of this effort to ensure that no challenge was too much for us to overcome. And I'm sure this is a lesson for anyone not to come forward and tell us that something is not possible because there are these obstacles. We have shown that whatever the world put itself to, and partners come together at every level of governance and community, it can be achieved. So I'm quite certain that it will be much less arduous if we pick up another project in future that collectively we all agree needs to be done. We should be able to do that even much faster than we've been able to achieve Rotary eradication, poliovirus eradication in Africa. And we're sure with the same efforts, we'll do the same for the rest of the world.
Well, I dare say we have another project on our hand at the moment with COVID-19. Dr. Funsho, how can we leverage your effort, your team effort, the country's effort you talked about? How can we leverage that, that we've learned in eliminating polio in tackling COVID-19?
I think we're already, using the resources of human and material resources that we've been using for the wild polio virus hitherto. One of the key elements of COVID-19 pandemic containment and eventual, hopefully, eradication is surveillance. We have trained personnel who, now have been used to do surveillance for us as far as COVID-19 is concerned. We have a lot of health personnel who have been trained in giving health education to people as to how to prevent themselves, using the key elements of safe distances, using face masks, washing hands, and sanitizers as frequently as possible, and ensuring that too close proximity is avoided, particularly in closed spaces. All those are things we have brought to bear as far as COVID-19 is concerned. And these are the legacies we hope we're going to take forward to be able to integrate into future healthcare interventions, whether it's a disease intervention, whether it's issues with nutrition or health education.
All right, Doctor, with 90% of the world's population now free from this wild polio virus, it's now endemic in only 2 countries of the world, Afghanistan and Pakistan. What is GPEI, Rotary, the organization you belong to, WHO and other partners or agencies doing to eradicate the remaining 10% of the world where we have the wild polio virus?
Yes, as much as we're going to focus attention on ensuring we don't have any wild polio virus finding its way back into Nigeria, our efforts are now focused on ensuring that we do the same thing for Pakistan and Afghanistan. Pakistan and Afghanistan have had challenges which are not unsimilar at some point in time to Nigeria's challenges. So we are going to leverage on the resources and our experiences in Nigeria, in Afghanistan and Pakistan. These needs a lot of funds. And Rotary is raising the funds with its partners and advocating with government to make funds available so that whatever needs to be done to rid Pakistan and Afghanistan of the wild polio virus is done. We expect, to spend almost $1 billion next year for this effort across the world, but most of it, I'm sure, is going to end up tackling, the menace of the wild polio virus in Pakistan and Afghanistan. Right. So funds are required. As far as commitments on the part of Rotary is concerned, that has remained even with added zeal now because we're almost there. We can see the finishing line, and our intention is to get there as soon as possible.
All right, you talked about funds. Let me just follow up on that. Let's discuss the importance of financing and its impact on this achievement and how we can best channel funds to also deal with other issues that the country and Africa is grappling with.
Yes, I think that is one area we should be working on assiduously. We have been quite lucky with Rotary being a major advocate to governments of the world to get the required funding up till this point in time. And we're hopeful that if we can get governments, particularly governments in countries like Nigeria, where the primary healthcare infrastructure is still not as good as we want, that more investment is made there. So that whatever is required to build up our health centers, staff them with qualified staff, and make sure that the necessary items that are required in terms of drugs and materials are made available so that the average person in Nigeria, no matter where they live, can access primary health care, which will take care of about 75% of the health needs of the average Nigerian citizen.
Well, Dr. Funsho, reports suggest that you should have retired years ago, but you declined and stayed on to fight this battle. What do you hope that your recognition will bring to millions of Nigerians, especially young people, who are despondent about their current socioeconomic realities and attitude to work?
I believe this recognition is a vindication that hard work in the long term pays. Once you have a vision, be in no doubt that you have the capacity to achieve those ends. Our environment now is replete with a lot of opportunities for young people. And all they need to do is to have faith in themselves. I mean, Rotary has never, and I have never wavered in my belief that polio can be eradicated from our world. And that is a very, very important thing when you set yourself a goal, have faith in yourself that you can accomplish that goal. And at the end of the day, whatever sacrifice needs to be made to get to that goal will help you to achieve, because you know, you anticipate, and you work through it, just like we've done for polio. Many challenges, but because we've made up our mind that this is a task that must be done, we continued and found solutions to those challenges.
A task that must be done, and the question of sacrifice cannot be overemphasized, Doctor. There are still some misgivings, if you like, from certain quarters about immunization and vaccination, even as the race to get a vaccine for the COVID-19 heats up. What actions are you and your organization taking to disabuse the mentality of these kinds of people?
Well, you know, it's always important for us, you know, to ensure that we don't take people for granted when we have an intervention. I think part of our initial obstacles with polio eradication is that we assume that, you know, we bring in something good to the community and the community should accept it with open arms without asking questions. I think, you know, with COVID-19 and with any other kind of health intervention, we need to carry the community along. We need to give adequate information and education for them to buy in to whatever the intervention is. That way, they will now drive the need to have this thing done. We have succeeded in doing that for polio, that families will now take their children to health center for immunization, and when we do our campaigns, they're willing to bring their kids out and have those precious drops of the oral polio vaccine, you know, put in their mouths to protect them against the wild polio virus and subsequent paralysis. So I believe, you know, public education and the right kind of communication is very, very vital for us to gain acceptance for whoever the end beneficiary of any of our interventions will be.
And Dr. Funsho, specifically at the moment, have you taken up any challenge in the fight against COVID-19? Yourself, the Rotary Club of Nigeria, is there anything you're doing specifically to help the country curb this virus?
Well, we've engaged, you know, at every level of the Rotary movement in Nigeria. We've engaged in ensuring that those who are suffering as a result of unemployment and have no resource, we'll provide them with palliative all across the country. We have also been engaged in education, educating the public as to the need to protect themselves and the rest of the public against the wild polio virus by doing those basic things I mentioned earlier, wearing face masks, washing their hands, using hand sanitizers, avoiding large crowds, and ensuring that as much as possible gatherings are outdoors. So we're educating the public, you know, as far as that is concerned. And we continue to make sure that, you know, the resources that we have been using to help us get to where we've gotten to now as far as wild polio eradication is concerned are leveraged onto our activities to prevent COVID-19 from further decimating our society.
All right, Doug. You are the leader of Rotary's Nigerian National Polio Virus Committee. Has the work of the committee ended with the eradication of the wild polio virus? What next?
Not at all. The work has not ended. We are at a point now where our new slogan is keeping polio at zero. A lot of work needs to be done to ensure that even if the wild virus comes back, and it's quite possible for it to come back, we still have travel between Asia and Nigeria, between Afghanistan and Pakistan. At some point in time, is going to start happening again. And adults can't carry this virus and shed it in our environment. If we don't ensure that all our children are vaccinated against the wild polio virus, they may become victims. So we have a major task in ensuring that we increase our routine immunization coverage from the current level of about 50% to at least 80–85% before we can rest on our oars. The final resting on our oars has to follow the world certification, polio-free. So until Afghanistan and Pakistan become polio-free, my committee and Rotarians across the world will continue contributing in one way or the other to ensure, that polio is kept at zero in Nigeria and that polio is eradicated from Afghanistan and Pakistan.
And how huge a task is this for Nigeria, considering that we still depend largely, if not completely, on donor agencies and partners for vaccination of our children?
Well, it's a task that we have been doing as advocates to government. The government of Nigeria, as a matter of fact, one must give credit that the government of Nigeria has been on board in both political will and also in funding. We would like the funding to be much more than it is now. And that is going to be part of our campaign moving forward, to engage the government at the federal level, at the legislative arm of government, to ensure that more and more funds are appropriated for the health sector, particularly for the primary healthcare sector, so that we can make sure that our children are immunized against all the childhood preventable diseases, including polio. I think it is something that we will continue to do and keep increasing government's financial commitment to the health sector, in particular to the primary healthcare sector, where most preventable diseases are dealt with.
All right, Doc, just like you said some time ago, we must not take things for granted. Yeah, we're talking about immunizing, which is, of course, when it comes, what really indeed causes this wild polio virus, so people can even begin to prevent it from coming upon their children. And then this question, you've achieved a great milestone. What are you doing, or people in your sector, I don't know, in your circle doing, something like a succession plan, people who will come after you to also get this kind of milestone?
Well, first of all, about transmission of the wild polio virus. The wild polio virus is what we call an enteric virus. It is transmitted, from unsanitary environments, that is from water into food, into the intestines of vulnerable people. It replicates there, and it finds itself from the intestine to the bloodstream and to the area where it actually affects most, which is the nerve endings in the spinal cord. That is what causes paralysis. And some of that virus ends up back in the stool, contaminates the environment again. If another child that is vulnerable takes water or food prepared by that water, may also succumb to it. And that is why oral vaccination is so effective in protecting the child who gets the vaccine and also the child in that environment, because the vaccine can recirculate, and even in an unsanitary environment, you can get immunity, but it's not coming directly from the vaccine. So that is one bit that I need to make clear. If we can get our environment sanitary, we can ensure that there's clean, potable drinking water, which is taking me to the next thing you asked about. We make sure that children don't get to take contaminated water, or their food gets prepared with contaminated water. Then the chances that they will get the wild polio virus even diminishes, in spite of low routine immunization coverage. The next aspect of your question, please remind me.
The succession thing, grooming people, growing people that can, follow in your footsteps and do Nigeria proud, or continue with where you left off, succession.
That is the wonderful thing about my organization, Rotary International. We have a succession plan. We have Rotarians in my community who have been in my committee for the past 7 years. And I could just walk away and do something else. And I have many members of my committee who will comfortably step into my shoes and carry on where I left off. And there are many, many Rotarians like that at the state levels, and who are eyes and ears. We have district officers, we have state officers. Even at club level, we have chairmen of Polio Plus. who are trained regularly, who participate in our activities. So there will be no vacuum if one person drops out, of the whole system. There is an efficient succession plan like we have all through our organization. At any point in time, we have a succession of 3 leaders. We have a governor in my district now. His successor is already known who will take over from him. And his successor also is known. So we have 3 people we call the triarcha who hand over to one another so that there is no vacuum if somebody leaves the arena.
Wonderful, Doctor. That's a great organization. I think that should be even carried on to governance level so that they can imbibe that culture. It's great. Once again, congratulations, Dr. Funsho.